who is the Senior Program Analyst with Netwo. So Nick, I will pass it on to you to introduce our collaborative session.
Thank you, Kenya. Welcome everyone. Thanks for attending the Retail Food Protection Seminar and today's presentation on the Retail Food Safety Regulatory Association Collaborative. I am just going to dive straight in and start to review our agenda, and then I'll also introduce the folks that are on the call with me today. So I'll be kicking off with an overview of the collaborative and our objectives. After that, I will pass over to Lori Farmer, who is the Director of the Office of State Cooperative Programs at FDA, and Adam Kramer, who's an Environmental Health Officer at CDC, to cover the federal government agency support for the Retail Collaborative in our work. Then I'll pass to Kayla Weckenborg-Tonka after the break. She is the research project leader for CFP, and she's going to discuss some of the work that CFP and Netwo have done focused on retail program standards networks. And finally, I'll turn it over to Steve Mandernack, who's the executive director of AFTO, to discuss AFTO's state survey that covers food code adoption, the retail program standards, and risk factor studies. And then last but not least, we have Laura Wilde on with us, who's a senior program analyst at NEHA, and she and I will be monitoring the Q&A throughout this presentation just to try and answer questions on the fly. So if you do have any questions that come up during this presentation, please just try and use the Q&A feature in Zoom, or if you want to use, poll questions or the chat in Pathable, we will be monitoring both. And with that, I will go ahead and just jump into our introduction to the collaborative for those of you who aren't familiar. So we'll start by just going through some of the members of the collaborative. So the Retail Food Regulatory Association Collaborative consists of the members from the CDC, FDA, Netwo, AFTO, CFP, and NEHA. So we have, each of these organizations has multiple members that participate in monthly calls. We kind of just work together to make sure that we're all making progress on a set of objectives that we set a few years back to try and open up more routes for collaboration and communication across organization, just to make sure that we are, hitting our goals for retail food regulation and retail food safety overall in the US. And just going to dive into the objectives. But first, I did want to take a step back and just provide some space to kind of shout out a group that we've had the pleasure of working with over the last couple of years, and that is our Retail Food Safety Advisory Group. So the advisory group is comprised of stakeholders from state, local, tribal, territorial health agencies, and also the retail food industry. And this group is really integral in providing input and feedback to collaborative planning, to our research projects, and to the final products. And we really wouldn't be able to have the reach in terms of the resources and products that we put out into the world if it wasn't for their effort in, reviewing our research plans and all of the work that we do in the collaborative. So moving into objective one, our first objective in the collaborative is to increase adoption of recent versions of the FDA food code. And this objective is aligned with the FDA's new era of food safety, which calls for uniform adoption of the food code. All of the associations have worked together in objective one on a food code adoption toolkit, which can be found on the collaborative website. With that toolkit, we have a food code adoption map where you can look state by state and see the most recent version of the food code that's been adopted by those states. We also have a presentation on food code adoption that can be used as a template for presentations pretty much anywhere, state level, local level, any conferences or meetings, anything like that. And then led by NEHA, we also have had a targeted food code adoption strategy in South Dakota, where we have worked with legislators and folks in a bunch of retail food organizations, just to kind of expedite the process of getting them on a more recent version of the FDA food code. And objective two is to improve the regulatory approach, competency, and food safety culture in the regulatory community. Under objective two, Netwo and CFP have conducted research projects to assess the application of risk-based inspection methods and effective intervention strategies with the assistance of AFTO. AFTO played a pretty big role in surveying folks, just getting an idea of what kind of intervention strategies are out there, identifying folks who have achieved conformance with Standard 9 and worked on risk factor studies that we could work with in our interviews and focus groups. They played a very big role in us being able to do that research. And then AFTO has also conducted surveys to understand elements of risk-based inspections. And they've also worked on assessing root cause analysis trainings available to folks at the state, local, tribal, and territorial level. In our third objective, we are trying to increase participation in conformance with the retail program standards. So in objective 3, AFTO has worked on identifying participation in progress with the program standards, resources for technical assistance with the standards, and auditors for verification audits of conformance with the retail program standards. And then Netwo and CFP have done a lot of work with jurisdictions that are participating in retail program standards networks to help advance their conformance and help boost enrollment in their jurisdictions with the standards. But Kayla's going to talk about that in a much closer detail later in this presentation, so I'll hold off. The collaborative's fourth objective is to improve outbreak investigations. So AFTO and NEHA have worked closely to create an outbreak investigation webpage, also to identify current resources and needs for foodborne illness investigations. And AFTO's worked on Train the Trainer series on environmental sampling, virtual trainings on best practices in foodborne illness outbreak investigations. And they've also used inspectional results from 5 states to try and understand trends in risk factor violations throughout the US. Our fifth objective is to increase active managerial control by industry operators. So NEHA has worked to develop strategies in a guidance document to improve active managerial control, increasing the number of establishments with well-developed food safety management systems. They created a report on AMC incentive programs around the country and how they can be used to improve food safety practices at retail. I know NEHA and AFTO also gave presentations this summer on AMC. AFTO also created an AMC and food safety management system course for food service leadership, which was piloted earlier this year, and also developed webinars and presentations on active managerial control. And finally, our sixth objective as the collaborative is to enhance communication of collaborative findings, tools, and resources. So all of the collaborative associations led by NEHA have worked to improve our communication streams by creating and maintaining a new website, publishing scholarly journals, and promoting collaborative tools. We all play a pretty big role in our own, social media platforms and our other communication platforms to spread our tools and try and really promote everything that all of the collaborative associations are working on. NEHA has also led the collaborative working group that's been focused on identifying 2 emerging trends in retail food safety and presenting those trends to the collaborative as possible projects to take on in future years, as well as reporting those emerging trends up to FDA. And then finally, NEHA conducted an interview project this year called Telling the Story of Food Safety, where Laura and Taryn worked at the NEHA AC in Spokane this year, interviewing professionals in the field, just trying to gather their food safety experiences and their achievements. And we're really working on that project in hopes of promoting some of, the really positive stories out there in the field with the folks who are really on the ground and promoting advancement in food safety practices. And with that, I am going to hand it over to Lori to cover FDA's support of our collaborative projects.
Thank you, Nick. And gosh, that felt like a fire hose of information, didn't it? And thanks.
It sure was.
Yeah, thanks for sticking with us for the rest of the day. And, what I really want to emphasize here is that retail food safety is a team sport. We can't do this alone. FDA recognizes that, and that is why we are bringing the leadership of retail food safety in the regulatory arena together to work on really specific objectives. And Laura Wadley is doing a great job of putting in the chat the location where a lot of these best practice documents are and model documents that you might be interested in that Nick just spoke about. This collaborative, we call it the collaborative, is a partnership. It's an equal partnership with everybody at the table, and FDA is an equal partner there. And we're going to be meeting next week face to face, and we haven't been together in 2 years, and we have done so much work, as Nick just talked about, virtually, that I am just ecstatic about what we can do when we get face to face, and really talking about the deliverables that are part of a funded FDA cooperative agreement, as well as discussing strategic direction and unfunded efforts. And this is all about bending the curve around foodborne illness. So FDA, what is FDA doing in these areas? Because we're not just dependent on the associations, we're all doing something. And you're going to hear from Adam Kramer about what CDC is doing to complement this work and to leverage it. So FDA, we're going to be sharing our under development food code adoption strategy to move the regulatory foundation of this country. We're going to seek to divide and conquer, as well as leverage the associations. There's just more work to do than we can do. And you guys know, just within the field operations, we have 27 retail food specialists. That's small. So we really need to multiply our efforts. And this program is all about multiplication. We continue to support the deliberation within the Conference for Food Protection and the publishing of the Model Food Code, as well as the Voluntary Retail Regulatory Program Standards. The 2022 standards were released late August. Also foundational is FDA's financial support of jurisdictions through the Retail Flexible Funding Model. This is the largest investment in retail jurisdictions in the history of FDA. This return on investment model, it drives jurisdictions to work on continuous improvement to get to conformance of the standards. And I'm really, really encouraged that you guys are going to get out there and get on the NEHA Retail Grant Portal and apply for some of these funds. So it closes October 12th. So go ahead and go to that portal and look and apply. We're especially looking for program standards mentors. There are many. This is the teach people how to fish model. We're all learning from each other. And that's the beauty of retail food protection, is a continuous learning model. FDA's risk factor study support includes a specialist support, program standards networks. We really want to see jurisdictions doing risk factor studies. That's really where you're going to see the impact. And we're doing a workshop at the end of the seminar on Thursday around risk factor study support. So, I just want to wrap up by saying there couldn't be a better time to be in retail food protection, and each one of you needed. Each one of you are the lifeblood of how we're going to move forward on bending the curve on foodborne illness. So Nick, I'm going to pass it back to you, and you can pass it on to our next speaker, Adam.
Perfect, Lori. Thank you.
Thank you.
And then, we're going to pass to Adam right now so he can cover some of the CDC information. And then we will break, and then we'll meet again. And Kayla and Steve will come in and talk about some of the specific projects.
All right. Can you guys see me? And if so, Nick, can we go to the next slide? Thanks. So as Nick said, my name's Adam Kramer. I'm an Environmental Health Officer at CDC's National Center for Environmental Health. If you heard the keynote with Laura Brown, I work on her team, just to give you an idea where we're at. So I wanted to focus today on one area of the collaborative's work, food safety management systems. And, Dr. Brown from CC really took a deeper dive into our findings in the opening session. Next slide, please. So a restaurant has a strong food safety management system if it has procedures, training, and monitoring to help that restaurant achieve active managerial control over food safety. And procedures refer to a set of actions adopted by management that minimize that food safety risks. Training refers to management ensuring employees are taught the food safety procedures, and monitoring really refers to observations and measurements to ensure that food safety procedures are being followed. And CDC really supports this collaborative objective because our research, as Dr. Brown had shown, has shown the incorporation of these actions really has led to better food safety outcomes. Next slide, please. For example, we have seen that delis with a written slicer cleaning policy are cleaning their slicers more frequently. Also, the restaurants with the policy or schedule for cleaning have smaller norovirus outbreaks. And next slide. And CDC data also show a link between training and certification in food safety is measured by practices, inspection scores, and outbreak risks. Restaurants with a certified kitchen manager had fewer critical violations on their inspections. Workers and restaurants with food safety trained workers were more likely to wash their hands when they needed to. So again, we're really seeing those linkages really applying there. If we go to the next slide. And finally, CDC studies support that link between monitoring and safer practices. In restaurants in which food workers monitor or record temperatures, food and equipment are more likely to be at the appropriate temperatures. I hate to say go figure, but it actually does work. If we go to the next slide. So in conclusion, CDC really supports the collaborative's goal of increasing the use of and improving food safety management systems because we have data that show links between these systems and improved food safety. I'd now like to turn it over to either Nick or Kenya to help get us back into the correct session to hear about really the exciting activities the collaborative's been working on from Kayla.
Thanks so much, Adam. With that, I am going to go ahead and pass it over to Kayla Leckendorf-Tomka to talk about some of the work that CFP and Netwo have been doing on retail program standards networks.
Thanks, Nick. Hi, everyone. Thanks for sticking with us through the technical difficulties this afternoon. I'm going to talk to you a little bit about a research project that we did surrounding networks. So if you can go ahead and go to the next slide, that'd be great. Okay, so the project objectives. So in 2021, Netwo and CFP, we collaborated to identify state and local retail food regulatory programs that were participating in state and region-wide networks. The networks were focused on working together to increase conformance with the retail program standards. The goal of the project was to explore how participation in the network helped jurisdictions achieve conformance with the program standards, and also to highlight any promising practices that could be shared with others across the United States. Next slide, please. Again. Okay, so you're probably wondering, what is a network? So for the purpose of this project, a network was defined as 3 or more jurisdictions that met regularly, either virtually or in person, to discuss, share, and work collaboratively to increase their understanding of or conformance with the retail program standards. When thinking of how the network was led, the network could be led by local jurisdictions, led by a state regulatory body, or a FDA retail food specialist. Participation of the networks was not limited in scope, and all jurisdictions were considered regardless of their size, regardless of their geographic area or entity, and only networks consisting of more than 6 local health departments were included in this study. Next slide, please. So a little bit about the method of how we identified networks and chose networks. There were resource limitations among the identified networks when this study was conducted, largely due to COVID-19 and staffing issues. We originally identified 13 networks, but only 3 of those networks were able to participate in the study. Individual focus groups were held with network members in Iowa, in North Carolina, and also in the Pacific Northwest. We also sent the focus group sessions were 60 to 90 minutes long and were facilitated by the Netwo research evaluation team. And then we also sent a follow-up survey to the network leaders as they did not participate in the focus groups. And the purpose of that follow-up survey was to gain insight into the logistics of how the networks were set up and how the network was maintained, because the network members may not have been able to answer those types of questions. Next slide, please. So what were the facilitators of retail program standards networks? The first one was really a network leader. So someone that was a network leader that championed and coordinated the network. They formed a closer relationship among other members in the network, and they also had more familiarity with the work and the resources of their peers. The leaders were viewed as experts in food safety and program standards, and they had the ability to interpret the standards and communicate information about how to achieve conformance to reduce barriers for other network members. Another facilitator identified was support. So that included grant funding awarded to local health departments that allowed network members to attend training and conferences that were focused on the program standards. Some examples included the FDA self-assessment and verification audit workshops, or the Netwo mentorship program. The network members were able to share information that they learned in those workshops among other network members that may not have had the funding or the staffing capacity to be able to attend those trainings. The last facilitator is shared attitudes and also motivation. So of the 3 focus groups that we held, 2 of the 3 networks had freely adopted the program standards, and the 3rd network was a state-mandated conformance with some of the standards, while the network promoted the adoption of all 9 standards as part of their shared values to improve food safety. It was noted that having the program standards was helpful as a guide for improving their food safety practices, and being a part of a network drew inspiration from their peers that had already achieved conformance with several standards. Next slide, please. So some of the benefits of participating in the network. Being a part of a network allowed network members to share strategies and also templates for achieving conformance with the standards. By sharing information, time was saved, and there was also consistency identified among members on how standard conformance was approached. Additionally, local health departments with newer food safety program staff benefited from peer-to-peer sharing by learning best practices and leveraging the experience of their peers who had already achieved conformance with the standards. Also mentioned was local health departments with limited staff capacity felt it was helpful to have access to documents and resources that larger health departments had already created that focused on the standards, as well as other food safety messaging. Improvement of food safety overall was another benefit identified as being a part of a network. Network members discussed how they conducted routine inspections and different enforcement procedures to ensure practices were consistent and also aligned with the program standards during their network meetings. Members also felt that the network served as a place for members to have a single point of communication regarding compliance to state mandates and also any emerging threats to food safety. Another benefit identified was strengthening of network members' project management skills and local health department food safety programs. So that really meant that network meetings were used to discuss more than just retail program standards. They also discussed a wide range of food safety topics that provided for peer connection well beyond the program standards. An example is newly hired network members that had recently been promoted to program management learned from the more experienced network members about ways to run a food safety program, including purchasing of equipment, identifying funding opportunities, and also establishing goals and priorities. The networks provided a space for members to collaborate to inform the food safety industry regarding the standards, and also allowed for a single voice for enforcement and regulation. Lastly, strengthening communication with state and federal entities was identified as a benefit. The networks provided a space for members to share information they received from state and federal entities about new policies or upcoming updates, and promoted equity and communication throughout the network. The network provided an opportunity for locals to ask questions of state agency staff and also get feedback to other agencies regarding the food code and program standard adoption. Next slide, please. There was very few barriers that were identified in participating in a network, but there were some. They were really centered around limited staff time. So we are all short staffed, so we know that we don't have time for another meeting. Also program funding, resistance to adopting the retail program standards among late career staff who may have been hesitant to change. It's always scary to do something new. A perceived burden of achieving conformance. That might mean that some people try to meet every standard at once as opposed to doing just one step at a time to do it in a more incremental fashion. And then also shifting of priorities due to COVID-19 or political resistance to additional regulations. Next slide, please. So what are the next steps? So what we plan to do in this upcoming year is evaluation of current networks that exist. So what we're looking at is, does participation really improve conformance with the program standards? And will creation of a network increase enrollment in the program standards among a region? We're really interested in finding out if that's true. What we plan to do is assist with the development of a new network and identify the baseline of conformance among members and then measure their conformance over time. Next slide.
Thank you, Kayla. And with that, I will go ahead and pass it over to Steve Mandenack to take us through the end of our presentation.
Well, thank you very much, Nick. It's great to be here today, and it's great to be with so many of our retail colleagues across the country. Today, I'm going to talk a little bit about one of the projects that AFTO did as part of the Retail Collaborative, and that was really doing an in-depth survey of the state regulatory programs. When we worked on the collaborative, we divided certain things. AFTO took the state programs, and CFP and Netwo primarily worked with the local programs. So let's go ahead and move into talking a little bit about what we learned during that survey. The survey had consisted of 62 interviews with state health and ag officials over about 6 months to complete. Interviews were based on a variety of things, including food code adoptions, including barriers, impacts on locals and future adoptions, program standards, enrollment and barriers, auditors, also for self-assessments, risk factor studies and challenges with risk factor studies, risk-based inspections, and asked a few questions about COVID-19 along with emerging issues. So what we think a little bit about that, the first question that we really focused on, and we'll give you some examples of the infographics that have been produced as part of this on our next slide. And there you go, gives you one example of what these look like. And through this process, we worked with researchers at Iowa State University to produce a variety of infographics related to the data and make them a little more accessible. Well, let's move on and talk about the first one, which is what food code are folks operating under. So the interesting thing that from my perspective that we learned was less than, and so we'll move to the next slide, Nick, sorry. The interesting thing that we learned from this was that, we ended up with approximately 60% of the states on 2013 or newer food codes. So that was very good. We didn't expect it to be that good, but that's a very good start. The other thing is 2% on older than 1999. So almost all of the states were on 60% were newer, and almost all were newer than 1999. Let's move on and talk a little bit about what that impact adoption meant. So with 93% of the states, when they adopt a food code, it does apply to local agencies as well. Of the 26 states that allow some sort of variation at the local level, 45% of them allow a local agency, the state code may, or state statute may allow local agencies to adopt their own local ordinance. And 92% of those 26 allow the local agency to be more stringent than the requirements of the state. So if the state allowed local adoption, often they could be more restrictive than the state was. We look at what the barriers were to adoption, which is the next slide. We talk a little bit about things that you would expect. Lack of staff or staff experience was the most common thing cited. Nearly, we're looking at 28 reciting that. Length and complex, time-consuming process was another common thing. Time was also mentioned by others as something that was complex, along with, of course, the legislative process, resistance, and timing. But a few things that we heard that we hadn't necessarily expected in this was that a lot of the barrier was just simply not understanding the adoption process for their state at the state agency or level. So essentially the food program management at the state simply didn't understand how their food code was adopted and had not been through that process. That might be a symptom of a lot of changing in staff. As we all know, there's lots of new staff in these programs right now. And that might have been one of those challenges. Another thing that we heard was that we learned throughout this was Many of the agencies also struggled with understanding the impact of an adoption. So some of those questions we talked about in the last slide, it was a challenge for some to go back and review their statute and the statutory authority and determine what was their current state system. So it was kind of an interesting discussion. When we get over to program standards, we learned a handful of things also. So the good news is 54% were enrolled, 12.9% were not. But the more interesting thing was of those 33 or 61% had a self-assessment that was current. Though I'm going to put a caveat in that. Each agency was allowed to define what current meant. And there were differences of opinion in that. So I think that was one of the things that as we go forward, we're likely to be more clear on that, but we weren't initially. So for example, if a voluntary, and then, so there were very interesting discussions during that process. The other thing is, it was also interesting that when we talked to those enrolled, that many of them weren't particularly clear on what the requirements for self-assessment and verification audits were. So that was kind of interesting at least the leadership level of these programs who typically answered the survey or participated in the interview. They didn't necessarily always understand that piece. Let's talk a little bit about what people perceived as barriers to enrolling in the program standards for those that weren't enrolled, or that were enrolled, sorry. Staff and staff turnover were a common barrier. Time, of course, other priorities, COVID-19, of course, during this period of time when these interviews occurred, that was a very common item. So, I think there's another interesting thing that we tended to hear is, of course, we heard very good things about the retail flexible funding model as support of the standards and the previous system supporting the standards. We also say that they also said that 6 months is reasonable, but many to get a voluntary to get their self-assessment verified, the verification audit completed. But they acknowledged that oftentimes they didn't meet the 6-month deadline, which was pretty interesting. They also said it was very important to have a dedicated person or program standards coordinator, really was what they were identifying as key to having success. They did mention program standards networks as something that they thought would be valuable. And they also talked a little bit about some other features that they might thought would be interesting. When we move into program standards audits, we did hear a couple standard things. Most of them did say it was reasonable to find an auditor or someone to complete your audit within 6 months. Though, like I said, they acknowledged that often they didn't make the 6 months, which was interesting. 72% said they would be open to an auditor that was provided by FDA. The top 3 barriers to conducting audits: time, finding an auditor, and staffing. So it all makes sense, kind of consistent themes throughout. They also did note that staffing turnover was a big issue, in that if you didn't have the person that completed the self-assessment still available, sometimes doing the verification audit became difficult. Let's go ahead and move to the next slide, which talks a little bit about risk factor studies. So studies had been done, but often few interventions had actually been successfully implemented. So the most common sorts of interventions we heard were posters and videos, but it was very hard to determine the effectiveness. Behavior change from these type interventions was really unknown. As at the time of the interviews, 38% of those that had a risk factor study were out of date for the risk factor study. And a majority of studies will be due in 2022-23. Nearly 38% of the jurisdictions that had completed one were due for a new one during that period of time. They also did find the risk factor study toolkit to be helpful and acknowledge that Food Shield had been a good tool, and that the data collection and report development had been helpful also. Let's move on into risk-based inspections. So one of the things that we learned in risk-based inspections was everyone defines risk-based inspections a little differently. And so I think in the future, what you're likely to see is us talk a little bit more about the key qualities of risk-based inspections and what people are doing in that area. So I also think part of that is no one may want to acknowledge when asked a general question that they don't do risk-based inspections. Of course, they did acknowledge that standards 3, 4, and 6 should be in place to support risk-based inspections. We did have some examples of behavior changing interventions, but mostly they were more, we'll just say, less active interventions. And a majority do require long on-site correction. Long-term tools mainly use some version of enforcement, such as maybe civil penalties or fines, for example. Let's move on to emerging food safety issues. The things that, of course, that we heard often is no shock to anyone here. CBD and hemp, home operations, reduced oxygen, sous vide was very common, along with other, the general other category, which was a hodgepodge of issues that didn't have more than one response. We also, again, heard about cottage food, which really could relate directly to those home operations. Seaweed and microgreens and sushi all came up separately in that number, which was kind of interesting. So, you know, heard about lots of different things that were out there. Of course, no surprise on any of these as issues that they did see as areas of interest. With that, that really kind of summarizes what the findings from the state survey. We'll be going out with another survey this in about 4 months. And when we do that, we're actually going to take all those lessons we learned on how to construct better questions and get better information to really do a great update of this information and learn more about what the progress has been in the last, since we did this survey almost 3 years ago. So thank you, Nick.
Thank you so much, Steve. And yeah, that concludes our presentation on the collaborative. I do have the collaborative webpage there. I know Laura shared that in our first session. My email is also here if you have any specific questions. Even if they're not nature related, I can kind of point you in the right direction for folks that can get back to you and respond. But otherwise, I will hand over to Kenya so we can get our closing remarks.
Thank you so much, Nick, and our collaborative partners there. Like I say, very good information. So thank you all once again for the presentation. And I won't keep you guys too much longer because we're already past our time. But I wanted to once again just thank you all for attending our conference, our seminar today. We have more great things in store for you for the rest of the week. Tomorrow, as Andre mentioned earlier in the opening remarks, is our breakout day. So these breakouts are set up kind of geographically like they used to be, but that doesn't mean you have to attend the geographical breakout for your state or wherever you're located at. So take a look at the agendas, as Andre said, see which sessions or which presentations interest you, and please join those when the time comes and when it's appropriate for you to join. Each breakout page has agendas with session times up. So once again, take a look at that and explore and see what interests you so that you can plan your day. We'll then reconvene here on Wednesday in general session. You'll have Christine moderating for you that day. So we hope you'll come back and join us then. We got a lot more things lined up for you. Log in a little early. Be sure to explore our FDA Teams page to learn more about our National Retail Food Team. That's one of those options up at the top of your screen. Continue to engage in those chat boards and message boards, and I've seen some of you send inbox messages, so thank you for that, and continue to reach out to your peers. And we also will be sending out, there will be a survey. If you take a look at the end of each session, if you go back in to click on the session, like you were going to go into the session, scroll down on that page, you should see a link to a survey as well. Once again, thank you all for attending. And if there's nothing else, and now we will see you all tomorrow. Have a great evening.